Hey everybody, this is Dr. Langdon again, board certified pediatrician, mom of 6 and grandmother to 2 with some quick tips on what to do for a sore throat. Everyone these days seems to have it from that recent lingering viral upper respiratory infection. So most sore throats are caused by viruses, typically worsened by that mucousy postnasal drainage. So first of all, if you do have congestion, make sure you're blowing your nose, not sniffing it up to increase that flow down the back of your throat. Second of all, if you have no nasal congestion, no runny nose, no cough, but you do have a high fever with your sore throat and notice some lymph nodes in the back of your throat looks really red when you look back there with a flashlight, then you probably need to go in and be seen to make sure it's not strep. Strep throat is caused by a bacteria, group A beta hemolytic strep, and needs to have antibiotics to prevent complications. Most sore throat is not strep. Please do not demand an antibiotic from your physician for just a sore throat or just because it looks red, because that's usually viral, and it's why it's so important to do that throat swab to make sure it's not bacterial. So when your throat is hurting, if you have a choice between Tylenol and ibuprofen, typically ibuprofen works better. Now remember, we're talking about older kids. We never use Tylenol younger than 2 months. They couldn't tell you they had a sore throat anyway. We never use ibuprofen under 6 months. But with toddlers and up, typically ibuprofen is the best choice as long as there's some food on their stomach. Now, for older kids who will cooperate, warm tea with honey is the best. It helps with the cough, but it also helps with the sore throat. Never use honey under 12 months of age, of course. Other things that can help, gargling warm salt water will sort of shrink that swollen tissue back there and loosen up some of that mucus. Drinking constantly helps. You can even drink honey straight on a spoon. You can use the throat spray, chloroseptic, and kind of hit the back. You can try some popsicles. That feels good. You can try hard candy or cough drops in the older kids, lollipops, and maybe slightly younger ones, and make sure you're brushing their teeth extra to make up for that extra sugar intake. You can try at night to elevate your head on several pillows. You can run the cool mist humidifier, take a steamy shower, and that can loosen up some of that mucus. Try to get all that mucus out. Stay very hydrated so the mucus will be thinner and easier to get rid of. I hope these tips were helpful, and if you have any questions, just let me know.